Hi, I'm Rick Walters with the Fort Wayne Smallest Winner. Today we're at the Physical Medicine Consultants and we're here to talk about diagnostic testing for the spine. Dr. Lazoff, can you tell me the most common way to look at the spine?
Well, typically the first type of test is an x-ray, and that looks mainly at the bone. That's important for fractures and things like that. The next step would be an MRI of the cervical spine or lumbar spine, and that shows more disc material, shows if nerves are being pinched, and what possibly could be causing some of the problems. The problem with the MRIs is that in the cervical spine, up to 40% of those can be abnormal in individuals and they may have no pain whatsoever. And in the low back, it's up to 70%. So you have to really put everything together with what the patient's telling you, their physical exam, and correlate that with the MRI.
Dr. Zolman, can you tell me of another way we look at the spine?
Yes, Rick. Another way to look at the spine is a test called an EMG. An EMG is a diagnostic test that looks at nerve function. So if a nerve has been pinched to the point where there's damage to the nerve, the test can pinpoint that for us, say what nerve is damaged, kind of tell us if that's new damage or old damage, sometimes tell us how severe the damage is as well.
Dr. Stinsland, once we've achieved that information, then what do we do?
Sure, Rick. Once we've obtained information like electrodiagnostic studying and imaging studies, then what we will do is an interventional type procedure where we look at identifying a pain generator. So for example, if an individual comes in with pain radiating down their right leg to the top of their foot, and an MRI shows that they have a pinched disc at L4-5, and electrodiagnostic studying also shows an L5 nerve root injury, we will then do a selective nerve root block where we place a little bit of steroid and numbing medicine directly along the course of that nerve. If that gives them relief of their pain, that confirms that they have a L5 nerve root injury. We're hoping that the steroid medicine will then reduce the inflammation and hopefully resolve this situation. All of this information can be used as a piece of the puzzle to put a complete picture together for each individual patient to provide them with the best possible care.
That's some great stuff. Thanks, guys. Follow along at FortWayneSmallestWinner.com.